part of the Affordable Care Act was forcing insurers to cover people with pre-existing conditions starting in 2014. The government even set up something called PCIP, a pre-existing condition insurance plan. That's basically a temporary high-risk health insurance program as a way to provide coverage for all these folks until then.
News Channel 5's Alex Sands has the story of two South Florida residents who are caught in the middle of this, what some may say is an unintended consequence of government action. It's a story you'll see only on 5. Alex.
And Jay, the government's own reporting says PCIP has saved lives yet. You look at the numbers and only a small percentage of people anywhere in this country are being covered.
Retired and uninsured, Gary Boyce worries.
There's still a lot of uncertainty about who they're going to cover and who they're not going to cover and what qualifies as a policy and what doesn't.
Time after time, he applied for coverage. Each time, he was denied.
In the meantime, something major happens and I don't have good enough insurance to take care of it.
It turned out his limited health insurance, a mini medical plan, it counted towards something called creditable coverage, something with a wide and varied definition. It includes group and military plans, COBRA, Medicaid. PCIP doesn't cover someone who's had this kind of coverage within 6 months of applying for it.
It's not an incentive for people to do the right thing. They're incentivizing people to go without insurance, for me to advise people to not have insurance so that they can get into this pool that will cover their pre-existing conditions. But in the interim, in the 6-month period of time, they run the risk of having just life happen.
According to government estimates, PCIP enrollment is significantly lower than first projected. As of March 1st, just over 4,500 people in Florida had enrolled in it, a fraction of the 56,000 or so enrolled nationwide. Nearly 70% of the people denied coverage by the federally run program had had some sort of creditable coverage within the past 6 months.
Being self-employed, they look at everything as a pre-existing condition, even like a sinus infection.
Shelley Natcham faces the same problem. Her health insurance plan covers major medical expenses. She's facing a tough decision.
As long as it has a copay or a deductible, they consider that insurance. So basically, they want me to go uninsured without anything for 6 months before they would even consider my application. It's crazy.
A worry as healthcare in America changes.
Up in the air is this. What happens if the U.S. Supreme Court strikes down all or part of the Affordable Care Act? A decision on that could come any day now. Meantime, policymakers say this 6-month requirement's a congressional mandate that PCIP was meant to help people who had no insurance at all. Shannon?
Alex Sands, thank you.